you are in my HSC 103 class, the introductory or the first year experience class for health science. That's just started this semester for the first time. I also teach HSC 110, which is for this course. And I teach HSC 262, which is an elective. It's an introduction to health careers, and that is new this semester also. So if you're undecided in what you want to do, you can come and take that course, and we kind of do a careers exploration of different healthcare careers that are out there. We're not necessarily going to say, you should be a nurse, you should be a PT. That you need to figure out for yourself, but we kind of expose you to the different healthcare professions and maybe a few non-traditional healthcare professions also. I also teach HSA 250, which is the medical terminology class. Pretty much speaks for itself. It's medical terms. I do always encourage students, if you're going to take the higher level of anatomy and physiology, the 220, 230, and you need that medical terminology class, take them at the same time. Apparently they run very parallel. So when you're learning the terms for the urinary system, you're studying the urinary system in anatomy and physiology. And then in the summer, I also teach HSC 310, which is healthcare delivery, and I'll let Dr. Nelson talk about that because that's what she teaches. And then I also teach HSC 305, which is professional communication. And that's where we learn about resumes, writing cover letters, mock interviews, how to professionally communicate with others in a healthcare setting. All right, Amanda, would you introduce yourself?
Good evening, everybody. My name is Amanda Huber. I'm the program assistant for the program, and I've been working with health sciences for 7 years. So I've seen a lot of things come and go since I've been here. So actually, initially, I worked in construction for 20 years until about 2008. And then that was at the time where the housing crisis began, and so construction decreased by a lot, so I needed to find something else to do. So I figured, well, go into healthcare because they always need people to work in healthcare, and I found this program and I thought it was just awesome. So when you guys decide to do your service learning classes, I will be the one that gets your background check and works with you on your immunizations and stuff like that. So you'll be getting lots of emails from me, and then also I am in charge of the listserv, so when you get emails on your listserv account, make sure you read all of those because they're very important information.
Got it. Okay, I'm Jamie Turgeon-Drake. I teach the HSC 110 class. I have 2 sections of you guys. I also teach HSC 330, Native People's Healthcare Promotion and Policy, and that one is about our indigenous population here in South Dakota, and we expand through the whole United States. You don't just specifically focus on South Dakota, but it's a little heavier focus on that, thinking that you're going to stay hopefully in South Dakota and continue your health career fields here in South Dakota. And that is a requirement for the public health, and also it's an elective in our class. In the course that I teach is HSC 380, and that's Health Literacy and Culture Care. And that course, I talked a little bit about today in class, dives deep into the racial and cultural groups that are mentioned in our census, and we break down their health disparities and go through all sorts of things in the social determinants of health. And it's a lot of vocabulary and terminology, and we dive deep into the racial categories in the U.S. and what that looks like and how the emerging majority is changing. What that looks like going forward in healthcare. The next course that I teach occasionally in the summer is our 460 leadership course, and that's Professor Wolf's class, and she'll talk more about that, but I do teach that online in the summer, and I have taught it face-to-face a few times in the spring. I also will teach our HSC 375 course with Professor Hook, and we're going to talk to you guys about that tonight after the meet and greet, so I won't break down a lot into that now.
Mushira Anis. I'm one of the professors here, assistant professor with the program, and I'll tell you a little bit about the courses that I teach. So if you're looking to fulfill your science requirements, those are some of the classes that I teach here. Usually in the fall, I teach anatomy and physiology, and then in the spring we have human diseases where we kind of look at the application of anatomy and physiology. I also teach 365, which is the disciplinary class. And this is usually a spring class, and in that course we look at different disabilities, specifically intellectual and developmental disabilities. So if you're looking to know more, and this is something that you're planning to work, or a population that you're planning to work with, especially pediatrics, that will be a really cool class to take, to kind of get some of those foundational skills under your belt. Another class that I teach is the HSC 440. This is the intensive writing class. So for those of you who are on the clinical pathway, or you're looking or thinking about graduate school, that will be another good class to consider, because we do focus on a health issue, and you get to spend the whole semester fun, right? Spend the whole semester studying APA and how to navigate the different science literature on that specific topic. So I hope to see some of you in my classes. A little bit about myself, because I know, are we still doing that, or are we doing that later? Okay, so next. Okay, Angela?
Hello, I'm Angela Landine. I am your teacher for public health, which is a required class, so I will definitely have you in there. One of my adjuncts is here that also teaches public health online, and then we have a third public health. Oh, and then my other public health adjunct, she's doing a hybrid of public health. So obviously you can tell, public health is really popular. I'll go into why that is popular. I also teach epidemiology. I have a lot of med bios in my epidemiology class right now, which is great. And then I also do global health. So those are my 3 core classes. I will put in a little plug for public health. So if you get into this health science major and you feel like, maybe this isn't really jiving with what I do, maybe I don't want to get into direct patient care, public health is your oyster. Every kind of facet you deal with on a day-to-day basis is encompassed in public health, okay? There's many different sectors within it. I will say when I was working in public health for different governments, state or federal government, I really never did the same thing twice. And I also worked for different companies that did different things within public health. So you're never gonna be doing the same thing twice every day. You'll learn a lot of different things. It's pretty fun. Or you can get into global health and maybe go to another country and do something like that. Should I mention the public health major? Okay, so we do have, we just got this approved by the Board of Regents. We do now have a public health major. A lot of you are probably gonna take the public health minor, hopefully, if you stay in the health science major. But again, if you kind of get in there and feel like maybe public health is your world, please come talk to me. I know lots of people. We can get you an internship, we can get you a job, we can work on it for a thesis. I joke, I actually think that the MPH program, the Masters of Public Health program here at USD, should be providing me a commission for all the students I put into that program. So I promise you would love public health if you don't want to do healthcare. All right, thank you.
Okay, well, my name is Becky Wolf, and I am a nurse by background, been a nurse for many, many years. I teach 3 predominant courses right now. The first one's HSC 350, which is it's called Principles of Healthcare, and it's all about ethics and the ethical situations you might find yourself in as a healthcare provider. I also teach HSC 450, which is a course focused on patient safety and quality improvement. So those are senior level college courses. courses, and so we spend a lot of time learning about how to keep patients safe, how to work as a team, effectively as a team, to keep patients safe, to reduce medical errors and situations that put patients at risk. And then the other course I teach also is at a senior level, which is HSC 460, which is called Leading Change. And in that course, we study in-depth leadership, how to become a good leader in healthcare, with a particular focus on self-discovery by using the principles of emotional intelligence. And then we also do a business plan. You'll work on developing a mini business plan. And so that's a very good course for you to take. Again, one that I think you'll find a lot of principles applicable to your work setting. Okay?
We're all just trying to volunteer. Awesome. Hi, everyone. My name is Corinne Gabbert. I am Angela's online HSC 315, so the Introduction to Public Health instructor. Something kind of unique, and it's not my 3 facts. I am a health science major. I graduated from USD with my health sciences major, and then I actually came back to USD for my master's in public health. So, like Angela mentioned, I was one of the students that thought I wanted to go into a patient direct care job. I found out through a couple different science classes that that wasn't the job for me, so I switched over to public health after I graduated. I currently work full-time for a public health education nonprofit in Yankton. I do have some experience on federal and state grants as well. So it's a great major. If you want to go public health or health sciences, I'm more than happy to talk with you. Jamie and I actually took our HSC 110 class together. So that was a little while ago. I just dated myself. But I'm excited to be here. If you guys have questions, feel free to ask any of us about our backgrounds. My background is public health, so I'm excited that you guys are here. And if you take online, you'll most likely have me.
Hello, I'm Brittany Schultz. I am the primary upper level advisor for the health science major. What I teach is resiliency, I support, help you figure things out, life goals, all that fun stuff that is in the classroom. So I recognize some of you, and I may have registered you at Fast Track or Transfer Day, but most of you are probably still not with me yet. So once you reach about 45 credits, or if you're planning on doing an articulation agreement, which means that you'll do 2 years here and 2 years at a tech program for whatever degree you want to do, I'll work a little more closely with you, but mostly juniors and seniors. I have been at USD for quite a while, about 8 years, and I was in the Academic and Career Planning Center for a while and just transitioned over to health sciences this past year. So happy to help in any way. If you have any random question, I answer lots of random questions about things all over campus. So I'd be happy to be your starting point. I may not know the answer, but I probably know somebody who does. So always feel free to reach out. I'm happy to help.
Hello, my name is Gwyneth Mockler, and I am teaching adjunct at the USD this fall. I'm teaching HSC 360, which is the technology care delivery class. That class covers a lot of different things. It covers how technology is shaping our healthcare field. We talk about virtual reality, we talk about robots, we talk about surgeries being done via telemedicine. We talk about telemedicine. We do a little bit of billing and coding, how insurance claims happen on the computer. It's just a really interesting class, and we cover a lot of things that don't fit into other classes as far as like technology and computers. I'm also teaching the hybrid version of 315, the public health. So I'm the third cheerleader for public health. It's a great field to go into. I'm a nurse by trade, and to me, public health is the communities are our patients. The states are our patients. So we see everybody as a group and how we can help people as a whole versus the one-on-one individual. But yet the one-on-one individual still mean a lot to us. So I'm still getting my nursing where I'm helping people and I see the impact that we have. But I feel like we can spread that impact out
of times they cross over between the two, especially now with COVID. At the clinic, we're getting COVID vaccines, and we're dealing with the state Department of Health every single day, so we're working together. It's a teamwork, so they work together really well. Yeah, so a lot of really cool class. Take 360 or 315, really good. Thanks.
Hello, my name is Logan. I am the GA for the Department of Health Sciences. I'm currently in grad school for speech pathology, and I guess if you get an email from me or see me in the classroom, now you know who I am. Be helping out.
Welcome, everyone. I am Amy Nelson, and I am Program Director for the Undergraduate Health Sciences, and I teach one specific course in the degree program, and it's called Healthcare Delivery, and I think I have a few of you in my course this semester. So in that course, we start with the history of the healthcare system and learn about how they needed to use whiskey when they had amputations because they didn't have anesthesia and all kinds of cool stuff like that. Then we moved to looking at comparing the healthcare systems around the world, so looking at the developed countries. A lot of students in that class initially think that it's about how to be a provider, so you learn how to be a healthcare provider, but really it's about learning about our healthcare system. So we learn about Medicare and Medicaid and Indian Health Services and the VA. It's a fun course, even though that topic might not seem really fun. I think the course ends up being fun because we end up having it be really patient-based. So you'll kind of follow a patient through their journey through these different healthcare systems, or I guess reimbursement entities. So that's a course that I teach, and then I also teach students throughout the year in different internships. So if you're interested in an internship, we have a checklist, and you can have an internship in a variety of different areas. So if you're a direct support professional somewhere, we can actually make that into an internship. We can make a lot of jobs into internships where you can earn college credit. And so it's really up to you to kind of be creative and come up with goals and find a supervisor, find an agency. And I've worked with students in a lot of different creative areas where they've got college credit for doing some really neat things. So please reach out if you want that internship checklist. I can help you with that. And I love to have students do that because I think it's such a great experience. Just a little bit about me. My background is occupational therapy and med lab science. I started out in med lab science, and I worked in that area for about 14 years, so I have a huge heart for hospital labs. And then I'm also an occupational therapist. And so if you have any questions about those two careers, I can certainly help you. And really our goal here in the undergraduate health sciences program is whether you have it completely figured out, you're sure what you want to do in healthcare, or you're really exploring, we want to help you. We want to spend the first couple of years of your undergraduate education especially really helping you figure out what you want to do and making sure that you have the right choice for you. And so that's what this class is about, and we have other classes that can help you. We have faculty members that are so committed to helping you figure out what you want to do and getting some really good experiences. And so I'm super proud of our team. We have awesome faculty, we have awesome staff, we have awesome GAs, and so, what's that? Adjunct faculty, yes, we have great people who can help you, so just don't be afraid to reach out to any of us. And I think with that, we're going to start with a game, unless there's somebody else.
She wanted to introduce the tech.
Oh, yeah, she's busy working.
So I wanted to make sure and introduce our tech fellow, Anna. She is actually a freshman this year with the poli-sci department. And so she's going to be walking around filming and taking pictures, so smiles and fun is required, okay?
Okay, I am going to show a couple of videos right now.